Happy Filipino-American History Month to all. This is Mindy Ofiana, your host of Rise Up, Real Issues and Stories of Every One of Us podcast. Joining us today on Rise Up is Ren Capucao Jr. He's a pediatric nurse at Virginia Commonwealth University Health and a PhD candidate at the University of Virginia studying nursing, digital humanities, and American studies. He's a nurse historian affiliated with the Yorn Center for Nursing Historical Inquiry. His research examines Filipino nurses' specialized realization and subjectivities in American nursing history since the early 20th century. He uses public history to reach broader audiences and advocates for racial equity on behalf of nursing, Asian, and Asian American communities, leading to previous collaborations with Virginia Humanities and Vox. So, how are you, Ren? How are you?
I'm good, Mindy. Thank
Oh,
you for
good.
having me on here today.
Absolutely. We are very honored that you are here. So, how was your week before we actually go to the formal questions?
Oh man, my week was pretty rough this past week. I was driving back and forth all across Virginia, not just for research. Well, some of it was for research, some of it was for teaching at UVA, some of it was to go to a wedding in Northern Virginia. So just a lot of driving and then working in Richmond at my job. So it was just busy because I hate driving actually. So I'm
Oh,
just tired and I'm trying to decompress myself and get back to work and get back on like being healthy and doing my exercises. So yeah, there's a lot to juggle.
So these long drives across Virginia, well, I know that there's beautiful trees there up in Virginia, and with this change of the season, how is that going up
Oh
there?
yeah, like fall I think is like I think that's why what I love the most about the East Coast, especially specifically about
Uh-huh.
Virginia, is that when it changes to fall, I think it's the prettiest season here because you don't get that
that's
like out
right.
west. I do
That's
want to move out
right.
west
Uh-huh.
eventually, but you don't really get that feeling. And I like
Oh,
wearing sweaters, and like having more
oh,
diverse clothes. So that's why I love Virginia.
Yeah.
So
you're
it's
right.
nice.
I'm in Southern California, so you're absolutely right. I don't see those four seasons.
Yeah, for sure.
You may have to link up with Mindy when you
Yes,
decide to move to the
Yes,
yes.
for
west.
sure. For
Yeah.
sure.
Yes. So, you're a nurse and a PhD candidate. So, what's the inspiration to going into the field of nursing,
Yeah,
Ren?
that's a long story. But it all begins with I guess sort of my cultural dissonance with the Filipino culture actually.
Uh-huh.
Because to me, growing up as a second generation Filipino American or second generation immigrant,
Mhm.
my values or what I was taught, in the outside world, outside of the home, it clashes with the Filipino values that are being taught at home. So a lot of times, when I'm like at school, a lot of my report cards said he's so quiet, because I was just very obedient, and my parents were actually very very strict. But so like I just associate Filipino culture with some things that I didn't like, and since nursing was very prevalent because I knew growing up. My mom's been a nurse,
Mhm.
or was a nurse. She was a nurse for 40 years, and then she retired when I graduated from nursing school. But for
Uh-huh.
her, I knew, I guess, from a long time through her that nursing was kind of one of those things that was ingrained in Filipino culture. It was like all I knew what like from terms of the knowledge that was passed on to me from my family was that food, Catholicism, and nursing. Those were the base like the tenements the tenets of Filipino culture. Because it's interesting, that from a lot of the other second generation migrants like me, not a
Uh-huh.
lot of us know the culture very well, and almost only like
Mhm.
maybe one or two out of like the over hundreds of Filipinos that I know, Filipino Americans I know, can speak the language. So it's interesting to see. It's there seems like there's a whether it's I feel like it's subconscious or not, but we're kind
Mhm.
of holding back our culture in some ways in terms of an assimilation, to kind of like go to kind of like fit into the mold that was kind of brought onto us by a long history of colonialism. But
Mhm.
moving forward, after trying to figure out, I guess, like my lost identity, really trying to understand myself. After I majored in history because I was, very rebellious in a way. That was me rebelling against my parents in terms of majoring in history because, there's a lot of jobs in history at a bachelor's level. But eventually, I think with more introspection for me, I learned more that there were certain traits like that I had, but also that my mom, helped cultivate through either nursing, but also Filipino culture, was my sense of empathy, my sense of compassion, and I really liked taking care of people. I really enjoyed caring for other people, and so nursing seemed like the best avenue to go to after my first degree. So I did a second degree into nursing program. So it was a master's program. And then from there, I went straight into my PhD. So I guess that's a long story short. Kind of, there's a lot of things were happening in my life that kind of just pushed me into the direction of nursing. Did I want to be a nurse initially? No, but it kind of just works out, and life works out in strange ways.
Isn't that amazing? Because I too was forced to become a nurse. But anyway, other than nursing and doing your PhD and all this, what's your hobby? What do you do outside of your work, your PhD responsibilities, um, other than
Oh
what
man,
we just heard?
Oh man, I get that question a lot. And the sad part about that question is that whenever someone asks me, like, my research or like my hobby is my my research. Like
Oh, wow.
I know, like to me, I enjoy what I got because I feel like if for you to pursue like a PhD, like you to like write hundreds of pages of one of this like very niche topic, you have to really enjoy it. If you don't, it's gonna be like a terrible experience. But I mean, other than doing that, I do enjoy running and writing poetry, and I do a lot of
Oh.
artsy projects with photography and digital art. But then my most recent hobby has been take. I bought a puppy this past this
Oh.
Oh.
early summer, and it was during my comprehensive exam for my PhD. Like it was during it. 'Cause I had so during that time I had it was a whole week where I had to write 30 pages in one week to like basically just vomit all the knowledge I knew about my subject. And then my puppy came on day 5, and then so raising him has been hard. But it was just funny though during that experience too. On day 3 of that exam, a swarm of flying ants invaded my apartment at 3 in the morning,
Oh
and like
no.
then I learned that these ants they come and they try to find an indoor place when they're trying to mate. So and these
Oh.
ants aren't
Oh.
like flies. Like you try to like wave your hand at them, they don't move. So it was like so hard getting rid of them. But yeah, my hobby like literally has been training my dog,
Oh,
and
wow.
yeah,
Best
Oh.
friend.
That is
Dogs are
that is
best
neat.
friends.
That is neat.
I know.
So I want to move into our main topic for today, and as you have said in your previous blogs and writing, Filipinos make up the largest group of internationally educated nurses practicing in the
Mhm.
U.S. Now, Ren, you have your studies. You focus on the history of Filipino nurses and their migration in the United States. Now, what inspired you to focus on this area of research?
I think what inspired me to focus on this area in particular, I think it's kind of funny that I did focus on it because for a long time I didn't really want to do anything with Filipino culture. But for me to understand myself better and my own identity, it made sense. So like going through nursing school and trying to like learn about like nursing in a way, going through it was I feel
Mhm.
like learning about my culture in a way, not directly, but in a way. But then I also felt like I needed to learn more. So not just this professional identity, but really my cultural identity. So why not combine
Mhm.
the two for me and try to also understand like with all this cultural dissonance that I had with my mom too, and my dad as well, like just my
Mhm.
family in general and other Filipino of the older generation. Um, how can I try to understand their perspective better to like, understand my own? So I think that's what really led me down this path of this research project or my dissertation research was to really just
Mhm.
to understand and to just to really grow from this. I think it's just really just a growing experience for me.
Oh, wow. So as you know, I was a CNO, and I my role mostly was um, introduction of the research into practice, right? So most of the time, my interactions are mostly with the researcher or whoever is the principal investigator. So you are the researcher. You must be talking to many people. How is that experience?
Honestly, it's an interesting experience because for me, as a nurse historian, we're very rare. There's only two schools in the U.S. or three in the
That's
world actually
right.
too that were there's a nurse where a nursing history or a nursing history focus is taught at the PhD level. So yeah, it's
Mhm.
we're a rare bunch, and a lot of times people question or they're confused, like, why are you studying history and you're getting a PhD in nursing, like because mostly when we think of a PhD in nursing, it's more very heavily science driven or clinically driven versus me.
Mhm.
I'm much more humanities policy driven, but so it's been interesting being able to in this as a nurse historian, I've been able to bridge the worlds of science and humanities, but also with my ability to advocate on behalf of nurses and the health of the health of the public, I've been able to also like go in there's so many different directions, and talking to so many different people from nonprofits like with Virginia Humanities, to
Mm-hmm.
expand the history of these nurses, but also to being able to talk of clinical knowledge with nurses at other like hospitals and such. So it's interesting, like just how nurses are able to sort of not translate clinical knowledge from make it simpler for the patient to understand. It's
Mhm.
interesting. Like I'm able to, I guess, kind of simplify from different worlds, to make it easier to communicate to a broader audience.
Mm-hmm.
And so I think that's been really helpful through my experience as a nurse historian in terms of communication has been really, really key. And I've met so many interesting people along the way from so many different fields. Like I always want to collaborate with everyone, but there's only so much time and so many things you can
That's
do.
true. Mm-hmm.
So, in your studies and being a nurse historian, focus on the Philippine migrants, what would you say is the impact of the history of Philippine migrants to the United States or to the Filipino American nurses now that you have studied?
Yeah. So that's like there's like a twofold answer or response to that question where, in an abstract sense or practical sense, most
Mhm.
people, I feel, nursing in general, not just Filipino nurses, we don't realize that how history is shaping our actions. And so
Mhm.
I thought it was kind of refreshing, or I was very humbled when a student from the University of Santo Tomas, in the Philippines, they
I'm a
emailed me
graduate.
asking for, are you? Yeah,
Yes.
yeah, I was like yeah, it's one of the students there emailed me, asking for my article from the online Journal of Issues in Nursing
All
because they couldn't get
right.
Mhm.
access to it.
Say
And they were
yes.
saying, I know, yeah, yeah, I sent it to them right away. Like, no
Oh,
questions asked.
cool.
Anything to support,
Sorry,
like
Manny.
this knowledge dissemination. But yeah, like it was refreshing to have him reach out, but at the same time, it's a realization that most of us don't realize our history, especially like with
Mhm.
Philippine nursing. It's when I talk to a lot of these nurses, they know like immediately what's happening, but like
Uh-huh.
the long-term history, it's not taught it's not taught well. Like it's not
Mhm.
really taught well here in the US either. Like all we know is, Florence Nightingale, and there's a lot of things that were great but also bad associated with her. So
Mhm.
it's important to, I guess, be aware of this history that's being more cognizant about it and how it shapes, our actions, but also like the
Mhm.
policy that's being made.
Mhm.
But in terms of how this history actually shapes us,
Mhm.
it's a very complicated where, like under U.S. colonialism, we see this this nursing's coming in and it's extending this imperialistic agenda. Like we don't the politics of care is so very interesting where because care we essentially we kind of associate it with kind of sometimes like with angels and like heroicism and such, that like we kind of
Mhm.
don't there's no room to critique it, even though we need to be able to critique this politics of care. So with nursing moving into the Philippines, they're spreading these Victorian values that are like very rigidly structuring how women should act, not in the Western world. So those values are also being placed onto Filipinos in the Philippines, but at the same time, it's being used as a tool to kind of to to kind of subjugate them in a way to like nursing is helping civilize them because they need nursing to help civilize. So it's one of the mechanisms of colonialism to help civilize the Filipino people. And so we see this trend ongoing in a ways, and even to the present where I feel like a lot of times we're just unaware of what's happening. But from doing some of my oral histories and reading some of my literature, I wouldn't say like not happy, like, a good amount of these Filipino nurses, I met, they never wanted to be nurses, but they don't have it. Like, there's not really in a ways, it's not a free, you can question the freedom of choice in choosing the nursing profession, there's a lot of questions like you have to ask, like, if circumstances wise, if the quality of life was better in the Philippines, if it was, as it was in the US, would nurses be coming here to the US? But then, that you have to address and unpack so many issues that are also in the Philippines to try to understand that situation. But it's very complicated, and trying to untangle it's so difficult. And since, the Philippines, obviously their economy runs on exportation of human labor, it's difficult to try to fix that. And so now we're seeing, from the early 20th century, it was kind of nurses were coming here on their own volition, and then it changes over time as the shortage of nursing basically happened in the US basically once the industrialization of the hospital occurred in the early late 1800s, early 1900s. So by the time of the mid-century, it gets worse with the Hill-Burton Act. Thousands of hospitals are built across the country, and there's such a huge shortage of nurses already in general. They're also recruiting nurses has served as one tool to ameliorate the shortage, and so it's just been ongoing since then. And like with the countries, because we see with these migrations nowadays that if it was a fair migration, then we'd see nurses going from countries from the global south to the global north and global north to the global south. It's one direction. So there's clearly a neo-colonial issue that's happening right now. And so I think we have to keep in mind that as well in terms of how do we view this larger picture, this larger history that's shaping our movements without us, really knowing.
The next question I have for you, Ron, is how was this history affecting the contemporary Filipino-American nurses?
Yeah, so in terms of affecting the contemporary Filipino nurses, I think as I said earlier, it's in terms of a freedom of choice of literally choosing if this is actually the profession they want to do, because you don't want a nurse to be a nurse if they really don't want to be it. You can be smart and become a nurse, but there are bad nurses that are out there. But also in terms of quality of life, yes, nursing does address in terms of improving quality of life of people who do take it at the same time. But it's weird how when Filipino nurses do come to the U.S., I've noticed in my research too, some of them also choose to not, further. They don't choose to become licensed. They stay they work as an LPN or they work as a CNA because they're still getting paid more and it's still better quality of life. And especially now with the current generation where a lot of times it's chain migration, so they're moving where they have friends and family. So they have the support system that they need versus from what I'm seeing from earlier generations where there's like nothing around them. So they forcibly kind of have to survive. You need to be able to perform at your peak level. And in terms of also just this, I see one of the underlying issues of them moving abroad too probably is the structural racism that permeates nursing in general. It's not a topic we address very often, but it's neither is the topic of the relationship between nursing and colonialism, they're very much tied together. Where uh, professional nursing, was basically invented, or not invented, but it was brought to light by Florence Nightingale, during the Crimean War, during like the mid 19th century. And so, with that period going on, it's also this same it's following the same period, I guess, where colonialism, or at least U.S. colonialism, is also slowly emerging. And so, with both periods kind of interlapping, we see them intermingling in ways where I guess we don't normally associate. Like I said earlier, politics of care. We don't want to critique nursing in a way, because it's or nursing or medicine, because apparently we're doing always good things. But as we've seen, like with the Tuskegee syphilis experiment, other such, there we do and Nazi experience. There's like so many atrocities that we do in healthcare, but we don't always acknowledge them. And so I think with this, there's a lot of things to unpack. There's a lot of issues that are happening. Like from what I learned also from talking to President Mary Joy, there is still like a human trafficking going on of nurses and such. And it's funny because like a lot of nurses don't even understand that it's actually happening. Like people think it's just happening to domestic workers, but no, it's happening also to nurses as well. And a lot of times why you don't see these kind of news in the headlines or as much, I feel, or it's not as brought to the forefront. But it's something that I think needs to be addressed in terms of like this larger picture of the politics of care.
Mm-hmm.
Well, Ren, I am aware of, sometimes in the news it comes up wherein you have newly immigrated nurses, and then depending on what's going on, but what we would hear is that they are either sued or penalized for breaching their contract. Um, but then some of them don't speak up. So how does this come into play? This long history you said of colonialism and this politics of care that's going on. How is this all interrelated? I know some nurses are afraid to speak up.
And I think I think that's a long, deep-seated history where when these nurses, first came here, like during the early, when they were either coming here to further education or actually like, moving abroad without the intentions of, without like the U.S. did not intend them to move abroad during the early 20th century, because, Filipinos were U.S. nationals at the time, so they could easily just move to the U.S. if they wanted to relocate. But but to try to blend in, you kind of have to, in a ways, be white passing, to be kind of subservient, to kind of put yourself in this role, to not make yourself stick out. So it's interesting to note that, like, I'll talk a little bit about my research, where some of these a lot of these early nurses, like in the 1920s, 30s, 1910s, like that are here, they're working and studying alongside white nurses versus, there's segregation, Jim Crow going on, and black nurses or even black women are kind of, there's less opportunities to become nurses for black women, and they're not even working alongside or studying, with white nurses or white women, but Filipinos are able to. And so I was looking at New York, for example, during the 1920s, why there was a choice. There in New York there was a black hospital and also a white hospital, and yet you would think that these Filipinos in the 1920s would be working at a black hospital. No, they're working at a white hospital, and they're also, during this time, they're also being recruited by white hospitals, which is very not a well-known history. But you see, like, they're being used by this larger racialized system, and it's unfortunate that they're able to succeed in some ways, but at the cost of like maintaining this color line, if that makes sense. And but also moving into the mid-century, when they're coming through the exchange visitor program, through the H-1 visa program of 1965, then you're seeing, if they don't act like they should be doing, they can easily get removed, sent back. So if you want to behave, like if you want to stay in the U.S., then you have to behave. You have to be normal. And so there's this history of being normal, and that starts all the way from colonialism, where nursing has input values of what being normal is. And I find that very fascinating, where like we see we a lot of times with Filipino nursing history, at least, or American history, even that too. Um, while nursing is very feminine, a feminine history, the early history of Filipino America is very masculine. We're looking at the laborers on cannery in salmon canneries and plantation work. But there's also Filipino men in nursing here at this time too, and they're subjugated to the hierarchy of the patriarchy of society, but also the hierarchy of nursing, where they're what's it called? They're also put under. They can't practice to the full extent of their nursing degrees from the Philippines because of this feminized hierarchy. But it's interesting in a ways where the way that the Filipino men in nursing have like they're kind of erased from history, but they're actually there in secret. And I don't know, I feel like I'm going off topic a little bit, but it's actually very fascinating to see how, I guess in a way, trying to go back to what I'm trying to say is I think part of the erasure of Filipino men in nursing, because they were very prevalent early on, was to try to normalize the nursing profession as a feminine, a gendered profession. And so they're kind of written out of history, but they're actually, there's not many, but they're actually like they're here. They were here in the US. Like one of the one of the archives I plan on visiting soon, as I have a fellowship at the University of Pennsylvania. And so there was actually a Filipino male student in one of the first, I think it might have been the first, but one of the few schools of nursing for men in the 1920s. So there's a history of them. It's just they're kind of obscured because it's a kind of a queer history. It's not considered what normal is to society. So
So, how does the history of colonialism affect the growth of the nurses as far as profession in itself? Excuse me, and also in leadership. You know, based
mhm,
from a staff nurse all the way down if you want to become a CEO.
mhm. So I think in terms of like going back to a little bit what I said, in this history of colonialism, the structural racism kind of sets it in a way where there's more, even for most people of color in general, there is what's the word, a glass ceiling in a way. It's obviously it's
Mm.
not as prevalent as it used to be. It's changing over time, but I think in a way there's still it's still there. I was talking to another PhD student actually that reached out to me to ask about questions about my work, but he's doing research on a lot of my internationally educated nurses in Canada, and it's interesting to note when like Filipino nurses are coming to Canada. When obviously the U.S. and Canada, they choose to say if your courses are good enough to to um, to
Yeah.
for you to move on, like for you to be a nurse. And so in Canada, I found out in their system, if it's not good enough, you can either take the classes and be a nurse's aide in the
Right.
meantime, maybe, or you can choose to get licensed as an LPN. And you
Mm.
see, the easier choice obviously would be to be an LPN so you can make more money right away. And so a
Uh-huh.
lot of times with these nurses, they're
Mhm.
going to forget about trying like they're going to get um, habituated into this like unless they have an urge to keep moving forward, then they're going to stay as LPNs. And then you see this structure, this structural racism where nurses are going to be mostly white. Then you'll see a lot of Filipinos who are LPNs, and like so it's you see kind of like it's just ongoing of these like smaller like they kind of just build up, just like how I was saying a little bit earlier how um with like it's similar in a way ish to the history of Black
Mhm.
nurses in the U.S. where there were very limited like I'm just gonna give an example here in Virginia in Charlottesville where there was a school of nursing. This was 19 1928 it was built. They didn't have its first uh, Black nurse graduate until 1971. So you can
Oh,
imagine like
Mhm.
wow.
they had that school, like they had a school of nursing, and for at least that was the bachelor's part of it for the 1928. But thing is, they also made a separate school at a black high school, Burleigh High School, it would train black women in as LPNs. So you see, there are choices that are being made to how to keep others down. And so the history of colonialism, it just kind of in the back of our minds, like when I was talking earlier too about this desire to assimilate, we just see it prevail over and over again. Like it's very rare, I guess,
Mhm.
at least around me. Yes, I feel like Filipino nurses, or like my mom and her friends, they're leaders on their unit, but they don't they have no desire to move beyond like leadership, like on their unit, like as their great charge nurse, nurse manager, but they don't want to move beyond that. And there's I mean, yes, a lot of it is in the individual choice, but at the same time, it's also like this ingrained colonial mentality, trying to are we able to move forward? Like, are we, will be taken down a notch if we try to go out of line?
Ren, I do have to share your story. Your story about the system in Canada has reminded me of the story that one of my schoolmates from University of the Philippines College of Nursing had to go through. And what she did was not to accept the system. So she migrated to Canada. I believe it was in the province of Manitoba, and she was told, you cannot be licensed as an RN. And she said, and how come not, right?
Mhm.
And so she says, I have the education, I have the degree, a Bachelor of Science in Nursing degree, and I believe that I can be a nurse here also in Canada, because she was a nurse in the Philippines. So what she did was work with the board of nursing in that province, and they were actually able to work it through so that nurses who graduated from the Philippines from a nursing degree could be licensed as an RN in that province. Now, I don't know the other provinces, but I do know of that particular one. So, as a follow-up question to our topic, what did you learn then about structural racism and xenophobia, if you may, in your research studies focusing
Mhm.
on Filipino American nurses here?
Yeah. So first, that's amazing that your friend was able to get through the system, because it can be
Yeah.
tough. And honestly, I think it's unfortunate that the model that was introduced into the Philippines way back when, it's a Western model. It's the American model, just little changed to be to fit the needs of the Philippines. But in essence, there's not that much that's different, to be honest. So like, to me, sometimes the judgments that are being made um, to the
Hmm.
to about whether these nurses' credentials are good or not. Sometimes I feel like
Hmm.
it's not always not always fair. But in terms
Hmm.
of the structural racism and xenophobia that I learned, I find it very spatialized. In terms of
Hmm.
it differs by place and by time, of course, but also the racialization process, like I was sort of talking earlier, it it's very intertwined with gender and sexuality, where we see nursing, it's very controlling of how women should act, how it should like
Hmm.
ostracize to kind of men, but also control how women should behave, how men should behave,
Hmm.
or how men can be abnormal if they are in nursing. So this racialization process, it differs across the places that I look at. So I specifically look at Seattle, Virginia, that's more modern, and then Hawaii. So we see in Hawaii during the early 1910s, I believe, when they start. I think 1908, 1910 was the first time they started recruiting cicadas, Filipino
Hmm.
migrant laborers to sugar plantations. So I was doing some digital mapping of early Hawaii, and almost every plantation had a hospital. And so after the Japanese were after the ban sort of on importing Japanese, then
Hmm.
Filipinos came in, kind of to took their place ish. And so Filipino nurses served as a sort of as a model for they served Filipino nurses. they were able to, or they were recruited to fill a niche to take care of, like, of the capital or the laborers. You need these laborers to make sugar plantation or to harvest the sugar. Without them, so nurses were kind of fulfilling this need. And at that time, there's mostly white nurses. Well, it still is mostly white nurses, but you need these you need these you need these nurses to fulfill this niche labor. And so we see that, and they're using Filipinos in ways like they're mediating Western and Eastern cultures in a way, because they're also taking care of it was a very diverse population that's on Hawaii, with so many different laborers, not just Filipino or Japanese. It was also Chinese, Russian, and Puerto Ricans. So we have that happening in the U.S. It's very economically driven. And like I was saying earlier, white nurses, like trying to recruit white nurses, to work in the sugar plantations with a mostly diverse ethnic population, it might not always be easy. And then, with the need for care, we're also seeing that with hospitals that had patients that from sugar plantations, they were, or the convalescents that, once they got better, a lot of times hospitals would recruit them. And I was doing some of my research that I began. Some of these like men were being trained as LPNs, like once they were healed up from tuberculosis, like a sanatorium of tuberculosis. So you're seeing how they're being used in a way to fulfill this labor niche. And so going back to Seattle, like moving to the mainland with these nurses, it's funny. One of my chapters, it follows this pair of Filipino nurses. They both graduated from University of Philippines, Manila, and they graduated in 1919. Then they both moved. Well, one of them was Laddie. He's a male nurse. He moved to Seattle first. He wanted to be a physician, and apparently a lot of men in nursing, not just Filipinos, they used nursing as a stepping stone to pursue a degree in medicine. And so that's what his goal was. And then Felicidad, the other nurse, she moved to New York in 1920, or she moved to Cleveland, Ohio first in 1926, because she was recruited by the hospital there. And so we're seeing ways where, let me start with Felicidad, where she's in Cleveland, Ohio, and she's working alongside. I have so many pictures of her at Cleveland City Hospital, and she's just there, being happy and such, or trying to embracing the American lifestyle. Then she moves to New York, kind of same thing. And it's weird, like you're not seeing the struggle that's happening in the background, which is, I think, interesting. But what's also interesting to note, like she worked at a Jewish hospital in New York, so like in 1929, and the U.S. Census categorized her and her friend. She dragged her other nursing friend along with her for this journey. They were classified as white in the U.S. Census, so that was also interesting to note. Yeah, so we can view the hospital as a way, as a extension of, because when we view the hospital, like I was saying earlier, with like how we view nursing, like the hospital is also a very sanitized, very hygienic, very clean place where, especially a white hospital, we see like with the rhetoric that's happening during this time, where we're associating black with bad and like white with all this holiness and goodness. And so like in a way, like donning these Filipino nurses in white garbs, these starched outfits, and putting them through this like rigorous militaristic training in nursing. They're kind of undergoing this Americanized training, and to basically kind of be sort of white passing in a way. And then eventually she moves to Seattle, or she reunites with Laddie, and they get married in New York, and then they move to Seattle and have a family, which I think is great. But Laddie, he, during that time period from 1919 to 1944, I believe, he was trying very hard to finish his prereqs for med school, and then go into med school. And he finally got into med school in 1944, I believe, 1940s. But we're not seeing, like I said, the bigger picture, the struggle that's happening. He worked as a lumberyard worker. He worked as an electrician, and then his brother and sister came over to the U.S. too. And guess what? His sister also wanted to be a physician. So a lot of times in Filipino culture, we always support our siblings, like especially the older sibling. So he puts his sister through medical school before he puts himself through. So he's supporting his family. He's supporting his sister, who was like one of the early Filipino women physicians. and she's also a nurse too, which is interesting too. But so he finally gets into school, at Loyola Chicago, I think, for medicine, and then he dies the next, like within his first year of med school,
Oh,
because can you imagine all of the stress that's happening
yeah.
in the background of
Mhm.
just trying to survive, just trying to make. He's working as an orderly. He can't work to the full extent of his degree because of
Mhm.
this sexualized racialization. But also, what was I saying? Even if he did, there's like larger questions asked too, because even if he did graduate from med school, he couldn't even practice as a physician in the U.S. anyways. So they would have to ask, like, do we need to go back to the Philippines? Because there's
Mhm.
with all of these with medicine and like pharmacy and dentistry, all these more masculine fields in healthcare, they would not allow people of at least a lot of people of color to practice in these roles. Like I know talking to someone from the Fawns organization, how his dad was the first graduate of the pharmacy school at the University of Washington.
Mhm.
Once he graduated, he had to work as a bottle cleaner afterwards. This was like the
Oh.
1930s, 40s, something like that, somewhere around that time period. So it's like there's like so many barriers on the way, and it makes you wonder: was the quality of life, actually better here, or not, or was it better back home? We don't know. Like obviously, it's a personal choice, but we're seeing with these stories these barriers to succeed. And then I guess let me just
Mhm.
summarize like my Virginia chapter where I it's one of the more poignant examples with Araceli Martial. She was one of the first oral histories I conducted. She was one of the founders of the Filipino Nurses Association of Virginia,
Mhm.
and her story always fascinates me of how she had to navigate the racism between moving north and then south across the eastern seaboard. So it was very more bel- it was very passive in a way. The racism in the north were very more subtle comments that were very just looking. It put you down, like as like I don't know, one of the things she
Mhm.
would say, one person told her was like, do you even know how to use utensils, like some things like that.
Oh, wow.
And
Mhm.
it's different in the north because obviously it's more integrated. But then when she moves to the south, like she's working. This is 1963, so the year before Civil Rights Act of 1964. But it doesn't really matter because hospitals don't desegregate really until the passage of Medicare, because that's when, if they want to receive government money, then they have to desegregate. That's one of the stipulations of receiving Medicare funding.
Wow.
But anyways, with with um with the South, she felt uncomfortable. Like like you want to speak out sometimes against these racist acts, but like sometimes you just have to know your place. And so for her, she was talking about how she worked with this one nurse, Agnes. She was a black nurse,
Mhm.
but then they locked, like she was working like in the basement floor of this hospital, like for the
Mhm.
OR. She would open it every morning, but then like she couldn't, like there's no way to help that situation. And then in the cafeteria dining room, there's separate cafeteria dining rooms, but from what I'm learning at this time period, uh it's not just her experience. From other oral histories I did, they expected white or Filipino nurses to sit in the white cafeterias, not the black cafeterias. So it was interesting to note like that we see Filipinos being kind of forced to choose a side. And obviously, you kind of have to choose the side, or it's a smarter choice to choose the side where there's more, I guess, power and more ability to a bit more room for mobility, and more like to
Mhm.
also keep you safe, I guess, in a way.
I see.
But that's the complicated. And then, but it's even more complicated when she goes outside the hospital, because when she goes outside the hospital, she's talking about how neither black or white Americans wanted her to use their bathroom. So she was jokingly saying, like when she would go to the park, she was jokingly saying, I have to bring my own potty chair to like use the bathroom when I'm at the park. So it's like things like that. Like I'm learning a lot of Filipinos kind of from that generation. They're kind of making light
Mhm.
of the situations to make it better. They're
Mhm.
very tenacious. They're very just keep pushing forward. And I think that's one of the things that I took away from my research, is that they work so hard, and they went through so much. Like I think there's a certain point where we have to push back, like,
Mhm.
and claim what is fair, what's equal to everyone. And so I don't think back then it was possible. Like it's so difficult. Like with
Mm-hmm.
how scattered Filipinos were during like when they're first coming in, they're more scattered. But now there's more of us, and I think, and now like with laws changing, like I feel as if there's more leeway in for us to make a change in healthcare.
I see. You know, despite the fact of the, for the lack of a better term, unfortunate experiences that Filipino American nurses experience, I mean, yeah, encountered, it's still a large volume of Filipino nurses or Philippine nurses continue to migrate to other countries for work. What are the implications of this?
Yeah, I was reading one of the books I was reading was what's it called? It was similar in a way. It talked about domestic workers though, but from my interviews with nurses that did, it's go to other countries, it seems though, from what I'm understanding, a lot of times there is a hierarchy of places where to go. Like some will go to Saudi Arabia first, and then you can't be a citizen there, so
Mm-hmm.
it's a temporary place. They know it's a temporary
Right.
stop, and eventually they'll
Right.
use that, and then the end goal is almost always or usually is the U.S. Like there's other countries too, but like
Yes.
usually most time the end goal is the U.S. And so it's very complicated to try to detangle by like in the current where we are now. um Racism and such is very tied together with capital, with the neoliberal economy of trying to saying that racism or racism doesn't really exist, because under capitalist values, all that matters is that we have the equality to for economic pursuits, to be able to build ourselves up. But that doesn't equate to the actual barriers that a lot of people of color go through, or and even like even previously colonized places go through. So that's why we're seeing this global south to global north migration. It's very one-sided, and I don't know. There's a lot of issues to address, to unpack, especially with
Right.
with the Philippines. Like we're sending so many nurses out, but um, well, I think there's a dire need to address the quality of life and the health disparities in the Philippines. Like they're very vast. Like we do have enough nurses. It's just they're sending out. There's not enough positions in the Philippines, and so they're all being sent out. And like with COVID happening, a lot of migration stopped. So you can imagine there's a backlog of nurses that are staying in the Philippines. And when I was reading this one book by Yasmin Ortica about the migration trap of nursing, where especially like because you have to guess, it's supply and demand for nursing, for nursing labor. How many do you need to produce, and how many think like the other countries will accept? And so, like with COVID, for example, you can imagine now there's a backlog of nurses, and the backlog keeps growing. And it's really sad when I hear that people or nurses have to pay hospitals to work for them to just get the experience to be recruited to go abroad. And so now we're seeing nursing in a way kind of it's not what it's not what it was cut out to be anymore. It's when nursing schools used to pay people students to become nurses. Now it's kind of the opposite, where now students are pay or nurses are paying hospitals to work for them. And that seems like a system that's somewhat very broken, and that's probably something that needs to be addressed. But also, I think a lot of us Filipinos, with the pandemic of COVID happening, like it's really sad when like a lot of I feel the care is centered around the metropolitan areas, like hospitals and the high tier care, where like just in my from a personal experience, like my family, like we're from a small fishing town in Bolinao and Pangasinan. I was born here, but that's where my family's from. And so with COVID rampaging everywhere, like my parents, like they lost a lot of their neighbors. They lost like my dad lost his two brothers within a week of each other. And it's just crazy like what's happening back there. And like for them to actually receive care, they have to drive 5 hours to Manila just to receive it. And I think it's it's somewhat it's problematic, and we need to I mean, I'm not trying to make judgments. That's not my role. It's just
Mhm.
there's interventions though that we need to do to make healthcare more equitable for everyone. And so that's where this colonialism kind of, or this colonial history plays in, where it's kind of pushed us in a way, or at least the Philippines in a way, to center around exportation, and instead of dealing with the massive health issues that are occurring within the Philippines. Because, oh,
So
one more thing.
we're
Sorry.
about to wrap.
Oh, can I add one more
Oh,
thing?
yeah, yeah. Go ahead. Go
There's,
ahead, Ren.
and there's just other like other people that I've met, a lot of like dentists and physicians that are retraining themselves as nurses in the Philippines or here in the US, that and to become nurses, they're like changing professions to try to
Mm.
like practice like in like eventually the goal is to become a nurse practitioner, to try to practice in a way, similar to how they did in the Philippines. But it's kind of crazy to think how nursing has become very commodified, or very kind of tied together with this upper for this what better way of life, when there's structural issues that we need to address, instead of trying to like just, I don't know, find these other ways out, which is really really unfortunate.
So to wrap up, Ren, I would like to ask you, with the lessons learned in researching the Philippine nurse migrants in the United States, what would be your message to the Filipino nurses?
I think um, one of my messages would be to always be thinking critically, think critically outside of the box. Like, always think of what's the alternative, what could be better, what could be different, what could make things go more smoothly. um,
Mhm.
don't be afraid of challenging like these normative values, because oftentimes, what's normal to someone else, to main side, is not actually normal. It's just this idea that's been embedded in us for over 100 years. um, and I think just being more, I don't know, being more open to this knowledge, to this knowledge, and being more open to what learning more about your history can bring to your own identity, but also to how
Mhm.
you can better yourself, better the profession of nursing as well. Because there's a lot of things that need to be untangled in nursing, but there, we think it's something that we all need to think more about, and try to digest and see where we go moving forward.
And this is all we have for this episode of Rise Up. I want to thank our guest, Ren Capucao Jr., and my co host, Manny Ramos, our director and producer, Rodney Cajudo, Carol Robles, PNAA Chair of Communications and Marketing, our advisor, PNAAF President, Nancy Hoff, our executive producers, PNAA President Dr. Mary Joy Garcia-Dia, and PNAA Executive Director Carmina Bautista. Join us every Wednesday here on Rise Up. Until then, keep on rising. See you next week.
This publication was made possible by Cooperative Agreement CDC RFA IP 21-2106 from the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of CDC HHS.